but I think this club is more of a prevention. It's a preventive club. The intent of creating this club is to how can we prevent various complications of diabetes? How can we make a life of diabetic prone individuals better? And most importantly, how can we bring less sickness, more happiness into the lives of the people? That's the only intent that we've created this club. When I say prevention, I think we as a healthcare provider, we always want to prevent rather than cure. I know a lot of people must be thinking, hospitals want to cure but not prevention. No, but right now, the focus of hospitals has also changed. We also want to prevent and make the community healthier and happier so that the entire India is healthy. I really congratulate and thank the team of Department of Internal Medicine headed by Dr. Ashwin. I think it's a great initiative, sir. I'm pretty sure I think this initiative will connect a lot of individuals, and I think they can also share their experiences, the way they deal with the disease. I always keep telling, whenever I come across someone who suffers with diabetes, I always keep telling them one thing: diabetes is a discipline disease. When we are out of the discipline, it comes to us. Of course, there are multifactorial genes and all that, but still, this is one kind of a disease which will bring us back onto the discipline. Timely food, timely sleep, rest, stress-free. That is what is all about the life. So I think we should take this as an opportunity to bring ourselves onto the line of the discipline and then lead our life healthier and happier. Thank you so much for taking.
As the CEO has already said, that this is an excellent initiative by Gleneagles Hospital to address one condition which is probably now becoming a kind of a pandemic all over the world. And the most important thing is, the quality of life that is getting affected because of one single condition called diabetes mellitus. So I think I must compliment Dr. Ashwin and his team to start this club. As the CEO very rightly said, we have so many clubs, but this club is going to address a very important problem which is there globally, especially in the developing countries, because it's a part of a metabolic syndrome. It's a kind of a lifestyle disease, and to address this kind of a pandemic, I think now is the call of the day. So I really appreciate this initiative. And
Club for Diabetes Excellence. See, here we are starting a club not for entertainment, but to share experiences, to share network. Imagine suddenly you have a low sugar of 90 or 100. You don't know whether to take your insulin or not. People are most of the time left over like that. They don't know who to connect to. The doctors have given the prescription. Sugar kammiya irundha edukuma sir, edukkodada. So how does we bring this experience together? So today in CODE, the whole purpose is to just fill in the gaps of these communication between the doctors, the hospital and the patients. We want to be there during your critical junction. When you can't make a decision, we want to be a part of it to guide you through. So that is what the whole club of diabetes excellence. And I do agree, in today's world, more than 5 to 10 minutes, even for interacting with the doctors, people don't have time. It has become a general virtue that the average time in India today is only 2 minutes for a doctor's consultation. So for the doctor also it is difficult to go through all the files and also present everything. It will take minimum of 45 minutes. So today when we go to a doctor, you can see that they will write a prescription, they will tell you how to take the insulin, they send you off. After which you don't know what to eat, you don't know how to interact, you don't know how to move on. So this club was basically connected or created for it to address all these gaps. So how are we going to address it? So once you give the code, you become a member of the Club of Diabetes Excellence. We are planning to conduct 2 weeks once. We are going to conduct on a second Saturday from 2 o'clock to 4 o'clock. We are going to conduct a session. It is not going to be the boring session where you bring multiple consultants, talk to you, try to get more number of patients. No, this is not a project of that nature. Instead, it is here to address the gaps. It's going to be a small group meeting which will be conducted and finishing up with IT. So we will constantly interact. We will have patient sharing experience. We will have celebrities who will come and share their experience along with you. We will have patient interaction and networking along with other doctors. And every week there will be different kind of doctors who are coming and telling you. One will tell you about diet. One will tell you about insulin techniques. One will tell you how to prevent diabetes. So it is going to be a feedback where we are going to constantly engage with the society to create a better and a healthier society. That is the only motive of this C.O.D.E club. It is not for patients. I am very happy to see all the patients are effectively engaging. We are also giving you an annual master health checkup when you enroll for the membership, which is going to cover your entire ear, all your eye, your legs, everything is going to be checked. And I think that this program is going to be very successful. And we will have more and more events. One time we are planning to have Zumba classes. One time we are planning to have swimming classes. So we will take this sport to the next level as and when needed. And we want people to live happily with diabetes. Today, diabetes is the only disease you don't have to worry about. Trust me. It's a mother of all disease. But if you know how to tame it, if you know how to keep it under control, that is the least of worry. That is the least of worry in today's world is diabetes.
Actually, I am drama, writer, actor, director. Now, 25 years of diabetes. Diabetes is not a disease. It is a disorder. That's all. Now, for diabetes. அன்றைக்கி என் ஃப்ரெண்டு ஒருத்தர் பார்க்குறேன், அதே ஷ்ரிங்காகி காடியெல்லாம் வளர்த்து என்ன சார் எனக்கு டயபிட்டிஸ் வந்துச்சு, ஏன் எய்ட்ஸ் வந்த மாதிரி இவ்வளோ பயப்படுறீங்க? டயபிட்டிஸ்ங்கிறது அது சாதாரண ஒரு சிஸ்டத்தை நீங்கள் சரி பண்ணணும், அவ்வளோதான். அதுக்கு இன்ஃபேக்ட் மை ஃபாதர் he was a lion and he was promoting blood donation, eye donation and awareness in juvenile diabetes. And India first time we took a short film in Namkudumamnu ஒரு டெலிவிஷன் சீரியல் வந்தது. அதில் வந்து இந்த 3 டாபிக்லேயும் 3 எபிசோட் எடுத்தோம். தட் வாஸ் ஸ்க்ரீன் இன் so many hospitals. இந்த வெயிட்டிங் டைத்தில் டயபிட்டிஸ்னும் போது சக்கரை அளவை கரெக்டாக பார்த்துக்கணுனாக்கா ஒருத்தர் வீட்டில் போய் டப்பாவில் வந்து அளவு சரியாக இருக்க பார்த்து தருவாங்க, இல்லை உங்ககிட்ட இருக்கிற அளவை பார்த்துக்கணும் அப்படின்னு சொல்லி அது புரியுது. அண்ட் இன்னொன்று டாக்டர்கிட்ட போனால் வெயிட் பண்ணணும், இந்த மருந்து தானே அவருக்கு என்ன கொடுத்துருக்காரு அதையே நம்மளும் வாங்கி சாப்பிடலாம், இந்த மாதிரி செல்ஃப் மெடிக்கேஷன் இதெல்லாம் பேசிக்காக எக்ஸசைஸ் இல்லாதவங்களுக்கு தான் கொஞ்சம் ஒபிசிட்டி வரும். ஒபிசிட்டி தான் ஒன் ஆஃப் தி ரீசன்ஸ் ஃபார் டயபிட்டிஸ் அப்படிங்கிறாங்க. அந்த மாதிரி ஒரு கிளப்புங்கும் போதே ஒரு ஜாலியாக இருக்கும்.